My name is Waimu Kimotho, and today we talk about vasectomy. Vasectomy is one of the available family planning options for men. Would you, as a man, get a vasectomy, or would you, as a lady, let your man get one? Today, Dr. Hassan answers a couple of questions regarding this procedure.
At what age should one get a vasectomy?
So that's a good question. So there is no particular age of when you can get a vasectomy. Any man can get it at any point in their life when they decide to. The only thing is you need to be sure that you want to do it. Usually we counsel, especially younger men, people who have not had children, then we counsel them to consider their choice carefully.
So who should get a vasectomy?
So basically, any man can get a vasectomy, anyone. So provided you feel either you've achieved what we say is a desired family size, so you've gotten enough children, or you don't want children, or you and your spouse have agreed that the best method for you as a couple is a vasectomy, feel free to seek help. It's available to everyone.
How does vasectomy work?
So a vasectomy, the simplest way to explain it is, as a guy, in your testicles, there's something we call a vas deferens. So it's basically a tube. So in your testicles, you make sperm, and then that sperm moves upwards and gets to your penis when you ejaculate through that tube. So basically what we do, we access that tube, then we disrupt that flow. So usually tunakata a bit of it, as a segment, so that that flow of sperm doesn't happen from your testicles and when you ejaculate, so there's no sperm.
Is this procedure painful?
So the procedure, more or less, any surgical procedure, first of all, is painful. Any cut is painful. So yes, there's some degree of pain to it, but manageable pain. So actually vasectomies can be done in different ways, and it can even be done what we call an office procedure. So office procedure means you don't necessarily have to go to theater. We just put a bit of local anesthetic on your scrotum, at the testicles, and it can be done. For people who now you feel you might be uncomfortable with that, it can still be done under anesthesia or sedation in theater.
So how long does the procedure take?
The procedure is very short, doesn't take too long. Like I said, it can even be done in the office setup. So 30 to 45 minutes, but it also depends on the experience and also the difficulty of the patient. So recovery, actually, in 3 to 5 days, you should be up and about. So we just recommend for the first 3 to 5 days, what we'll say light duties, and then in those 3 to 5 days you can avoid sex. But otherwise, apart from that, it's just mild pain that is manageable with painkillers. You should be able to move around, to go about your daily business.
How do you know the procedure was successful?
So after the vasectomy, we do something called seminalysis. So like I said, the way the vasectomy works is we are stopping the flow of sperm from your testicles to your penis and in your ejaculate or cum. So basically, we test your ejaculate to make sure it no longer has sperm, or it has less than what we say 100,000 motile sperm. So motile sperm is non-motile sperm. So sperm has to move around. So sometimes you might have sperm that is not moving around and it's less than 100,000, then we know it works. So either no sperm or non-motile sperm. Yeah, but this is not done immediately. It's done after around 3 months.
So can you have sex immediately after vasectomy?
So like I said, you might have mild pain down there. So in the past few days, maybe 3 to 5 days, you might have a bit of discomfort having sex. But after the 3 to 5 days, you can actually have sex. You can begin with what I would say like light sex, very non-strenuous sex. So yeah.
Does vasectomy work straight away?
No. So, okay, yes and no. So the thing I wanted to, like I told you guys, remember we said The vasectomy works by preventing sperm from getting from your testicles and then to your penis when you come. So, however, in that tube is very long. If you are to stretch it out, it's more than around 5 meters, but it's in our body. So that tube, at any one particular time, there's still sperm inside. And so for the first 3 months or so, you might still have sperm in your ejaculate or in your cum. So until we need to empty out all the sperm left in the tube, and that's why for the past 3 months or until the seminalysis, as we said earlier, has confirmed you have no sperm, usually we advocate either you and your spouse either use condoms or she uses another method until we confirmed that there's no sperm in your ejaculate.
Does vasectomy affect my sexual function?
Sexual function does not change. So remember, sexual function in men is controlled by your testosterone, which is unaffected. So libido palilikuwa tu ni mali itabaki. So no issues with sexual function.
And will I still be able to ejaculate?
You will still be able to ejaculate, just without the sperm, the 10% which was the sperm. You might just notice a difference in either the color of your ejaculate or the consistency. But aside from that, you will still be able to ejaculate kama kawaida.
Can I reverse my vasectomy if I change my mind?
Yes and no. So it can be reversed, yes. But even with reversal, sometimes the chances of successfully getting back to it working, they're very low. And that's why we said, before you think about a vasectomy, you need to undergo counseling, and you need to be sure that it's something you want.
Does vasectomy prevent STIs?
No, it does not prevent STIs. Anyone having sex without barrier methods. So barrier methods is condom. So any sex, enye watu wanasema nyama kwa nyama, in short, can give you an STI, HIV.
What are the risks of vasectomy?
To be honest, it's a very safe procedure, very minimal associated risks. But I would say the most common ones will be, and all of these are less than 1 to 2% of all patients. So pain, as you mentioned, because it's a surgical procedure and there's a cut, you might have a bit of bleeding from where the cut is made. And then in a small subgroup of men, you can develop what we call chronic scrotal pain. So that's just pain that doesn't go away. But like I mentioned, in around less than 1% of patients. Then there's something we call a granuloma. So sometimes because of that tube, the way it's disrupted and you're still making sperm, the sperm can leak out and you might develop usually a very small swelling around your testicle. But it doesn't affect function, and in most cases, it's painless.
What are the advantages of vasectomy?
First of all, as a guy, they offer you that assurance of, since you've decided to use it as a family planning method, they offer you that assurance of a method that works. So when you're looking at family planning methods, the only method safer than a vasectomy is abstinence. Technically, a vasectomy is slightly more effective than even tubal ligation done in a woman. So it offers you that confidence that you have undertaken your family planning. And also in scenarios where now you and your spouse have discussed and she's unable to have the other methods. Let's say hormonal methods don't work for her, ama pia taking things like the pill daily are very cumbersome. It offers even her the comfort of knowing that the two of you have secured your family and your future together.
Does vasectomy make you less of a man?
Vasectomy doesn't make you less of a man. So remember what we said, your libido remains the same. And by the way, once you've done the vasectomy, no one even knows you've done the vasectomy, apart from you and your spouse, and anyone now you guys decide to tell. But no one else will know that you had a vasectomy. So it doesn't make you less of a man. Your testosterone is the same, your libido is the same, your function is the same. If anything, a lot of men report it brings you and your partner closer, because now Even, like I said, it boosts your confidence that you won't have mishaps.
Love Matters. Open, honest, sex friendly.